Hello, good evening, Mr. Shabazz. I'm very, very glad to give you the information and update for the today's topic about the IVF preparation and the counseling. And many times patients, they will be asking you and asking us about the success rate and what are the things they should do before IVF preparation. And what are the counseling that they should consider and give information to the patient. And basically, most of the time, the emphasis and the information which they want is about the success rate and how many cycles they can have. The first question is, what are the preparation for IVF? How the patient should be prepared? One important thing which patient they should be very much well informed is they should be very much motivated. And they should come to us for IVF treatment when they are young. It's not right that you leave IVF aside and keep it as a last option. And when you're old and 36, 37, 38 years after that you come, because then equality will not be good, the aneuploidy chance is there, the AMH is less, the ovarian reserve will be less. So these are the things that it is better to come early when ovarian reserve are good and endometrial receptivity is very good. Other preparation which patient, if she has a hydrocyclings, is patient should decide, and also counseling should be given by us 50-50. Because many times patients, they are dependent on their tube. With their tube, if it is infected, of course it gives less chance. So that also to be tackled and to be cleaned and to be removed before doing IVF. If there are any fibroid, which is a submucous fibroid, large fibroid, that also to be removed. I have seen one of the center has done multiple IVF, 5 times IVF on a patient who has fibroid. So if one IVF failed and still patient is not able to get success, kindly review the case and remove the fibroid, make the patient more and more fertile before we transfer the embryo. Or if there are any ovarian cyst or chocolate cyst, that also has to be tackled and that has to be removed. But in the removal of the chocolate cyst, removal of any ovarian cyst, we should be aware that it may hamper the ovarian reserve and AMH. So this is a very double-edged sword, will be where we have to have both pros and cons, and we have to go with the laparoscopy very, very cautiously about this patient. If there are any infection that has to be treated before IVF, or any cervical lesion is there that has to be treated before IVF. And the other one which we have to be very much giving the information to the patient is about the success rate. If all these are good and ovarian reserve very good, we get very good egg, and at least 7 to 10 good oocyte we get, and 5 or 6 blastocysts we get, success is there, success we get. As per law, we are not supposed to tell 100%, but in our mind, many times we will calculate that yes, this is a success case. So basically, with the kind of the new development, phasing facilities, segmented IVF, our success rate has gone up. So that's why we should encourage and give awareness to the patient to come to us as early as possible. Side effects, same, multiple pregnancy. Once we diagnose that there are multiple pregnancy, patients should decide whether they want to go for fetal reduction or no. OHS is also very less nowadays. And there, frankly speaking, in the hand of an expert, there should not be much of the side effects. Thank you very much.